Hello, my name is Madam Jennifer from Educare TZ. Welcome my lovely Form 4 student in a biology session, and we are proceeding with the Necta series for the year 2010, and welcome. The today question is question number 13 for the 2010, and the question states that write an essay on birth control method which do the following. Write an essay on birth control method which do the following. The first one, suppress the formation and or release of the gamete. Second one, prevent the union of gamete in fertilization. Prevent the union of gamete in the fertilization. And the last one, prevent the implantation of fertilized egg. Prevent the implantation of the fertilized egg. My lovely Form 4 students, as you see in this question, once we talk on the instruction, this is a freehand question. Haijakupatia limit on the number of points you need to give in this particular question, lakini imeweza kupatia the instruction ni kwamba uandike an essay katika birth control method, lakini kwa kuzingatia the following instruction. Na katika Roman A uelezee the method of birth control method which suppress the formation of the gametes. Second one, uandike an essay of birth control which prevents the union of the gamete or fertilization. And the last one, uandike an essay on the birth control which prevents the implantation from taking place. My lovely Form 4 student, it is amazingly that this topic is one of very common topic for you, and is that it is from the topic of the Form 3 in that topic of the reproduction. In the reproduction in mammals. Nimefundisha hapa Educare Media, kama haujaisoma bado you are most welcome. Kuna sababu pale tatu, the concept of the reproduction in plant pamoja na reproduction in mammals. Make sure kwamba unazisoma zote. All parts are important. So swali letu la leo natoka katika concept ya reproduction in mammals, katika ile concept ya family planning and contraception. It is one of the very common term ambayo tunasikia sana sana mitaani kwetu, uzazi wa mpango. It has become a song now. It is very obvious and very common for you, my lovely Form 4 student. So our today question is us to write an essay pertaining this particular birth controlling method au uzazi wa mpango. We have seen that now kuna njia mbalimbali za uzazi wa mpango. There is natural, there is chemical, mechanical, as well as the surgical method, as we have learned in our topic on the lesson on the reproduction here at Educare Media. So let us be familiarize ourselves with the concept of the family planning. After there, we can look or we can go direct to the question concerning the birth control method. Once we talk on the family planning, this is a process or this is a practice whereby couples tend to agree on number of the children they need to have and at which interval they need to have those numbers of the children they intended to have. And that is known as the family planning. You can't accomplish the family planning without the use of the birth control. So the birth control, these are the practice which are used by the couples so as to ensure that they get the numbers of the intended children at a given interval they intended to have those particular number of the children. So when you talk on the family, where this question will be derived from the topic or from that concept of family planning and contraception, the family planning, this is a practice where a couple decide when to have a child and the number of children they want. Also, the family planning allow people to attain their desired number of children and the interval between their babies. So the family planning need enable couples. This is only for couples for planning and attaining the number of the children, their desired number of the children, and the interval between their baby. Also, this can be achieved through the use of contraception or birth control. So this process can be achieved through the use of the contraception or birth control, where the question has been derived. The question needs you to write an essay on the birth control practices which prevent the formation of the gamete or ovulation, prevent the fertilization or the union of gametes, and the last one which prevent the implantation, which are processes which occur after the fertilization. So the birth control is a practice of use of device. So this is a practice of the use of the device or practice that prevent contraception or practice that prevent the pregnancy. This is known as birth control. So contraception involves either blocking the fusion of the sperm with an egg cell and therefore prevent fertilization or making the female reproductive system hostile to sperm and implantation. So our question has been derived from this concept, where you are needed to write the birth control concerning on the practices which prevent the block the fusion of the sperm with egg cell, and this is fertilization. Also, the one which prevent by making the female reproductive system more hostile to sperm, which can also affect the fertilization. Also, another one which prevent the implantation. So let us see now. By starting with the first part, which were needed to write an essay pertaining on the birth control which suppress the formation or the release of the gamete. We have studied that there is a process which once a lady or a female reach the maturity, the puberty, they tend to experience the menstruation and ovulation. So the ovulation, this is a process whereby the matured egg is released from the matured Graafian follicle under the control of the luteinizing hormone into the fallopian tube for the fertilization. And where the fertilization becomes unsuccessful, the menstruation results. So here, the question is you to explain the method which prevent the release or this which prevent the formation of the egg or matured egg or ovulation. This is what the question is you to explain. So the first one, there are variety of the birth control which are used to suppress the formation of the gamete, which once released might result to the fertilization. The first one is the common method. This is known as the chemical method. When this chemical method, the people tend to use the tablet or the injections or chemicals to suppress the functioning of the hormone, which is known as the follicle stimulating hormone, which is secreted by this pituitary, the posterior pituitary gland, which are essential for the stimulation of the development of the egg, in which at each month only one egg is being released at ovulation, and when the fertilization becomes unsuccessful, a woman tends to experience the menstrual period. So this chemical, they tend to suppress the functioning of this hormone, which is known as the follicle stimulating hormone, so as to prevent the formation of this gamete, which may result to the fertilization. So the chemical method, this involves the use of the chemicals or drugs to prevent ovulation or inactivate the sperm. Kwa hiyo hapa inasaidia katika kuweza kuprevent the fusion of the gamete, au kuweza prevent the release of the gamete, ambapo hii chemical inakuwa na prevent the ovulation, ambayo ndio release of the gamete, ambayo ni female gamete, au kuna zina drugs ambazo zenyewe zinasaidia inapelekea katika inactivation of the sperm. So a common method used in this chemical method or birth control method include the use of the contraceptive pills, vidonge, kuna vibanzi, implants, kuna spermicidal cream ambazo zinawekwa katika female reproductive tract, na kuna birth control injection ambayo ni sindano. By starting with the first one ambayo ni contraceptive pills, how hii contraceptive pills inakuwa affect the formation of the gamete or the ovulation in female. The contraceptive pills, example common, kuna this one ambayo sasa hivi ni very common, kuna kidonge kinaitwa P2, kuna meso. Yes, that's the common name. So the pills contain estrogen pamoja na progesterone hormone. Kwa wale wanaotumia uzazi wa mpango wanaendaga hospitalini, wanakuwa napewa vidonge vya uzazi wa mpango. Na hivyo vidonge huwa vinamezwa kila siku na vimebi located number. So meaning that unatakiwa uzimeze kulingana na mtiririko. Usije ukafanya kivingine ambayo inaweza kapelekea ukaribu the normal functioning, namna gani zimeweza made up. So hivi vidonge vya uzazi wa mpango vime contain the estrogen pamoja na progesterone, ambazo these are the very crucial hormone katika female, ambao katika progesterone na estrogen inasaidia katika ovulation na vile vile katika repairing and maintaining the thickness of the endometrium for the implantation. So this hormone inhibit the production of the follicle stimulating hormone, and these pills are taken daily and are very effective and do not interfere with the process of sexual intercourse. So these drugs or these pills, they do not interfere with the process of the sexual intercourse. A woman can have a sexual intercourse, lakini ni kwamba just the fertilization itakuwa successful due to the suppression of this follicle stimulating hormone, meaning that ile ovum haitakuwepo katika fallopian tube. In case hata sexual intercourse ikatekea, the sperm itakapofika katika fallopian tube haitakuta the egg for fertilization. So, however, the side effect such as heart and related cardiovascular disease, weight gain and breast tenderness in some women may rise. For women who are using these particular pills, contraceptive pills, to prevent the contraception, they tend to suffer from variety of the diseases. So it's not very, it is haishauriwi sana, ni muhimu lakini pia haishauriwi sana. So kwa sababu inapelekea magonjwa kama heart, vile vile cardiovascular disease, uzito kuongezeka. Kuna mkuta wengine alikuwa mwembamba ameweza kutumia vidonge amejaa, amenenepa. Vile vile breast tenderness kwa baadhi ya wanawake. Vile vile women should seek medical advice concerning the use of such pills and perform regular medical checkup. Once you decide with the couples, kwa wanandoa tunapo kwenye ndoa, make sure kwamba unapo decide on the way on the birth control method, unakuwa mna face the certified medical personnel so that you can get the instruction on how to use this particular, uweze kujua the effect na uweze ka choose the safe ways ambayo utaiona kwako ni sahihi. And this is example of these contraceptive pills. As you see here, zinamezwa kila siku na kila maybe numbered per day. Kila siku, kila kidonge imeweka siku yake ya kumezwa. Nyingine ni injection ambayo hapa ni sindano. Injection contain the progesterone hormone which are administered to women once after every 1, 2 or 3 months depending on the type. Inategemeana mtu amechukua vidonge vya muda gani, either vya mwezi moja, miezi miwili au miezi mitatu. So, they suppress the ovulation, creating a hostile environment with the female reproductive system. Kwa kazi moja ni kwamba wana suppress ovulation, meaning that the gamete is not formed. Cha pili, wanaongeza ile acidity ya female reproductive system tract ili kuweza kukill the sperm. This is example of the injection ambayo ni sindano zimekuwa zenyewe zimecontain the progesterone hormone only. Zile pills zenyewe zimecontain the estrogen pamoja na progesterone, lakini hizi humu kuna only progesterone ambayo ina be injected. Another ways which prevent the formation of the gamete ni implant ambayo ni vibanzi, vijiti. So these are the thin plastic rod that contain the progesterone hormone. The same implant na yenyewe hapa ni thin plastic device ambayo yenyewe within it kuna progesterone hormone. Inakuwa inapandikizwa under the net of the skin of the woman. Sana katika mkono wanakuwa naweka hapa implant. Mimi contain the progesterone. So this progesterone hormone, they are placed under the skin in the upper arm of a woman by medical experts and left there for 2 or 5 years depending on the brand. So zenyewe zinaweka katika sana katika mkono wa mwanamke. Kwa wale ambao wameweka kabisa, ukiangalia unakuta inaonekana na inaweka kulingana na masako ya mtu. Either mtu anataka mimi nataka niwe na watoto wangu kila baada ya miaka 3, nataka niwe na watoto wangu kila baada ya miaka 5. Inategemeana na mtu anahitaji ya muda gani. Na it can be removed pale ambapo inahitajika. Na moja ya madhara hii hapa implant ni kwamba zingine zinapotea mwilini, inaweza kapelekea hata kansa. So the hormone is absorbed gradually by the body and prevent the ovulation. So within this plastic kuna ile hormone ambayo ni progesterone na be absorbed taratibu na katika mwili na kuweza kuprevent the ovulation. So in case hata mtu ata practice say unsafe sex katika ovulation, katika danger day atapata ujauzito. The rod can be removed anytime or if the woman decided to get pregnant of any other reason. Hata kama ndio umeweka miaka 5, vile vile ukiamua kwamba no, mimi sasa hivi nimekaa muda mrefu nataka niwe na mtoto, unaruhusiwa, unaenda hospitalini unatolea ile implant na hivyo one can conceive a pregnant. Of other medical reason, either kimepotea inahitajika kuweza kutolewa, inafanywa surgery, inatolewa. This example the implant inaikuweka katika skin underneath of the arm of the skin of the woman. And the question number 13, Roman B, you need to write an essay on the birth control on the method which prevents the union of the gamete in fertilization. Fertilization, this is a process of the fusion of the male and the female gamete so as to form the zygote. Meaning that the male tend to release the sperm while the female tend to release the ovum during the sexual intercourse. Once they fuse, they tend to form the diploid, the zygote or the embryo ambao tunaita the fertilization. So that process of fusion of these two gametes, male and female gametes, which are produced from the specialized sex organ or from the gonads, are known as the fertilization. Usually for female, the fertilization take place katika fallopian tube. Is where the fertilization take place because during the ovulation, the matured ovary is being released from the matured ovary is being released, ovum is being released from the ovary and to the fallopian tube for fertilization. So the question is you to explain, to write an S on the birth control which prevent this fertilization or the fusion of these two gametes. So the method which used katika prevention of the fertilization mechanical method. Mechanical method, this involve the use of the devices which prevent the fusion of the gamete. So the mechanical method of contraception involve the use of some kind of the devices to prevent the entry of the sperm into the oviduct or create the hostile environment for implantation to take place. Meaning that after the successful fertilization is where there is the implantation. Baada ya fusion of the gamete napata the zygote. Ambalo baada ya hapo ndio kuna kuwepo na ile implantation katika uterus. Kwa kazi ya hizi hapa mechanical method ni katika kuweza kuzuia the fertilization kuweza take place na vile vile kuweza ku create the hostile environment to prevent the implantation. Fertilization inaweza kukaa successful lakini kuna zingine ambazo zinaweza kupelekea ile implantation isiwe successful either hata kuharibu ujauzito. So they include the use of the condoms, sponge, diaphragm, and intrauterine devices. And according to our question here, we are going to discuss a little bit for pertaining the use of the condoms as one of the methods which tend to prevent the fertilization from taking place. By starting with the condoms, these are thin rubber sheet which prevent the sperm from entering the female tract. So this is made up of the rubber sheet ambayo ina prevent the entrance of the sperm or the male gamete to the female reproductive tract during the sexual intercourse. So during the copulation, meaning that the sperm will not get deposited into the female reproductive tract. Instead, they can be deposited in this thin rubber sheet or the condoms. So you tend to collect those sperm so to prevent that direct contact which can result to the fertilization. So there are two types of the condoms which are male and female condoms. By starting with the male condoms, the male condoms is one of the most widely used barrier method in the world. This is one of the very common and it is familiar to you. It's one of the very common method which is used in the family planning method. So this is a covering made to fit over the erected penis. So once the man is sexually aroused, is where the man tends to wear the male condom so that before the sexual intercourse so as to prevent that direct contact between the male reproductive organ as well as the female reproductive tract, which might result to the fertilization. So it will collect the semen during the ejaculation. The ejaculation, this is the process of the release of the semen through the penis, while the semen, this is made up of the mixture of the sperm as well as the accessory gland. These are the feces fluid which are released during the ejaculation, during the sexual intercourse. Also, they tend to contain this semen. So, they tend to collect this semen during the ejaculation and provide a complete barrier between the penis and the vagina. So, they tend to provide a complete barrier between the penis and the vagina by ensuring that there is no that direct contact which might result to the fusion, which might result to the fusion of the gamete, which might result to the fertilization and the pregnancy. So, by providing this complete barrier between penis and vagina, so that the sperm do not get deposited into the woman's vagina, as a result, fertilization cannot take place. This is example of the male condoms on how it look like. Another is female condoms. This is female condoms is thin, loose rubber fitting made up of two flexible plastic rings on either ends. And this female vagina or male vagina, it is inserted or it is weared before the beginning of the sexual intercourse. Another method which prevent the fertilization from taking place is surgical method. The surgical method, this is one of the irreversible method. Once it is done, it is done. Kwa hiyo yenyewe ina involve the cutting either of the fallopian tube na kuweza kuikunja au the sperm duct so as to prevent the entrance of the sperm to the female vagina or the ovulation, the release of the ovum to the fallopian tube, which might result to the fertilization. Kwa anakuwa na perform the surgical method au ni operation. And this mostly is done by the couples ambao tayari wameshakuwa na watoto wao wametosha na hawahitaji tena kuwa na watoto, anakuwa na perform this surgical method. So the surgical method involve undergoing a surgery to prevent unintended pregnancy, and such kind of surgery inaitwa sterilization. This kind of the sterilization it is of two kind. Kuna male sterilization pamoja na female sterilization, ambapo kwa male tunaita vasectomy na kwa female tunaita ni tubal ligature. So vasectomy or the male sterilization, this involve the cutting and sealing of the vas deferens ambayo ni sperm duct. Most sperm duct kazi yake katika collection of this sperm from the epididymis to they tend to collect this sperm from the epididymis na kuweza kuzipeleka katika urethra. So the vasectomy does not affect the hormonal secretion, therefore the sexual intercourse and ejaculation are not affected. And the tubal ligature or the female sterilization ni kwamba it involves cutting or sealing of the fallopian tube in a way that ovum cannot descend into the uterus, ili kuweza prevent the fertilization. And the last question, this is a structure ambayo inaonyesha the tubal ligature pamoja na vasectomy ambayo ni cutting of the sperm duct, na hii hapa ni cutting of the fallopian tube ambayo ni tubal ligature kwa ajili ya prevent the fertilization. Another and the last one question of this question ni part C ambayo inahitaji tuweze tuandike an essay on birth control regarding on the method used to prevent the implantation of the fertilized egg. Implantation, hii hapa ni kitendo cha kuweza kupandikiza kijusi katika uterus. Within the uterus where the implantation take place. The implantation take place after the successful fertilization. After the successful fusion of the male and female gamete, is where the implantation will follow. So after the successful fertilization, so there is birth control which prevent the implantation. And this method is called intrauterine device. The uterine device, this is placed within the female uterus where the implantation do take place. So after the fertilization of the male and female gamete in the fallopian tube to form a diploid zygote, now the embryo tend to descend towards the uterus for the implantation. So this barrier tend to prevent that successful implantation. So the intrauterine device, this is a small plastic or copper strip bent into a loop or coil. It is placed in the uterus by qualified medical care provider and left there. As it is foreign body, the IUD create a hostile environment for implantation. Kwa hiyo hapa intrauterine devices kwanza natakiwa iwekwe na mtu ambaye ni certified medical doctor ambaye amesomea na ana ujuzi. Sio kaenda katika zahanati katika maduka dawa ya mtaani au mtu ameanzisha dispensary chake au hujui kama ni qualified or not. Make sure kama unaenda katika hospitali ambayo imebe certified na inatambulika na serikali, na ili upate doctor ambaye ana umahiri katika this particular sectors ili aweze akakufanyia this kind of aweza kupandikizia hii device katika uterus kwa wale ambao hahitaji the having the baby or contraception for that particular time. So they tend to be inserted there and they tend to provide the hostile environment to prevent the implantation. Kwa hiyo ina maana kwa zinapelekea kuweza kuharibu ujauzito. Vile vile one disadvantage ya hii hapa intrauterine device ni kwamba zinapelekea miwasho katika uterus, inapelekea vile vile ina michubuko, inaweza kupelekea bleeding, na vile vile inaweza kupelekea hata cancer. Na another disadvantage ni kwamba uterine devices inaweza katoka katika uterus bila mtu kujua. Kwa mfano wale ambao wanafanya kazi ngumu, inaweza katoka unconscious bila kujua. Kwa mtu anaweza kujua kwamba na intrauterine device kwa ajili ya prevent the unwanted contraception na akaengage katika unprotected sex na akapata ujauzito. So this is not a wonderful. So it is one of the behavior of this particular birth method. So this is the structure of the intrauterine devices which is placed katika female reproductive katika uterus by the certified medical doctor Kwa ambaye yupo qualified ndio anajua namna ya kuweza kuiplace katika uterus kwa ajili ya kuweza kuprevent the implantation. So, my lovely Form 4 students, that mark the end of our today enjoyable session. Hope that you have understood the session. In case of any misunderstanding, misconception, any suggestion, you are welcome to write the comment section so that we can cross-check and make a follow-up for you. Thank you for your careful attention. Also, I would like to remind you to keep on following Educare Media. Don't forget to subscribe, comment, and like in our media for further learning. Have a nice moment.